Good evening and welcome to the nightly telecast of Just the News. I'm Faye D'Souza. Thank you for watching this video. We attempt to give you the news every evening at 9 o'clock without any opinion, any shouting or any drama. This is only the information that you need. Let's get straight to it. India has reported over 2,95,000 new COVID cases and over 2,000 deaths in the last 24 hours. This is, again, the highest single day spike and deaths recorded so far. But I want to draw your attention to one particular data point. There have been a total recovery of 1,54,761 people in India over the last 24 hours, which means our recovery rate is currently at 85.5%. And this is really where the problem lies, because 1.5 lakh people are recovering, but nearly 3 lakh people are testing positive every single day. So the recovery rate is about half of the new cases rate, and that's really where the pressure is being added onto the system, because every day that then compounds into more and more people who need oxygen, who need beds, who needs ICUs, and who need medication that we're currently falling short of. Maharashtra remained the worst affected state, followed by Uttar Pradesh, Delhi and Karnataka. India has now reported a triple mutation variant of the virus. States like Maharashtra, Delhi and West Bengal are believed to have cases driven by this triple mutant. Now you'll remember that up till now there was a report of a double mutant, which basically was a version of the virus which had 2 changes in it. There might be a version of the virus with 3 changes, or 3 variants have combined, called the triple mutation. Now we're possibly going to hear a lot about that in the future. According to NDTV, Professor of Epidemiology at McGill University, Madhukar Pai, has said, and I quote, "This is a more transmissible variant. It is making a lot of people very sick very quickly. We have to keep tweaking the vaccines. For that, we need to understand the disease, and we need sequencing to happen on a war footing." End quote. Sequencing is when scientists study this mutation specifically in some randomly tested people. He also said that delay in detecting the double mutation may have contributed to the current spurt of the virus in India. As many as 22 patients died today in a single hospital in Nashik in Maharashtra after the oxygen tanker sprung a leak. There were around 171 patients being treated for COVID at the Zakir Hussain Hospital in Nashik when the oxygen supply was cut for 30 minutes, resulting in the deaths of at least 22 people. Nashik Collector Suraj Mandhare has said the people died because the pressure of the oxygen was reduced because of the leak in the oxygen tank, which is being provided by a private company. The company looks after the maintenance of this tank as well. The Prime Minister Narendra Modi and Maharashtra Chief Minister Uddhav Thackeray have expressed their condolences on the incident. Maharashtra Chief Minister has ordered an inquiry into the incident. Those are the visuals that you can see on your screen. Delhi has been in the middle of chaos as far as oxygen is concerned, and it's been going on now for 2 days. The Delhi High Court issued a contempt notice to oxygen manufacturer Inox for non-compliance to its April 19th order. The court on the 19th of April had directed Inox not to divert any of the oxygen supplies from Delhi to any other state. Now this comes after a petition was filed on the matter, and Chief Minister of Delhi Arvind Kejriwal had recently asked the centre to provide oxygen supply immediately. The Council for the Delhi government has informed the Delhi High Court that the company violated that court order and did not supply oxygen to the state as was promised. Justices Vipin Sanghi and Rekha Pali have said, and I quote, "Notice has been issued to Inox yesterday to file a reply. Since no reply was filed, now a contempt notice has been issued." The Delhi government has claimed that more than 100 metric tons of medical oxygen, which was allocated to Delhi, has been diverted by the centre. This is the claim of the Delhi government. In fact, things got really heated last night when Chief Minister of Delhi Arvind Kejriwal tweeted very late last night and expressed concerns about reports of an oxygen crisis in the city's hospitals, saying that hospitals are left with just a few hours of oxygen, and he asked the central government to help. Delhi Health Minister Satyendra Jain also tweeted late last night saying the GTB hospital right now at 9 p.m. There is a stock of medical oxygen supply sufficient until 2 a.m. in the morning. If supply is not received before that, a catastrophe may occur at the hospital. End quote. The Sri Gangaram Hospital received 4,500 cubic meters of oxygen from a private vendor and 6,000 cubic meters from Inox late last night. We understand that the hospitals that were in crisis received oxygen in the middle of the night and the crisis was averted, but of course temporarily. In the meantime, Haryana Health Minister Anil Vij has accused the Delhi government of stealing oxygen from the state of Haryana from a tanker that was on its way to Faridabad's hospitals on Tuesday. And to avoid any more such incidents, Mr. Vij has issued instructions that all oxygen tankers in the state of Haryana will be escorted by state police. In a series of tweets, Anil Vij has alleged that a tanker carrying oxygen supply to Faridabad's hospitals was allegedly stopped in Delhi and the precious gas was taken out. And about the supply of oxygen and the availability of oxygen in Haryana, Anil Vij has added that the supply of oxygen in Haryana is currently in surplus. They have a production of 270 MT of oxygen from Haryana's plants, but they currently use about 60 MT of oxygen. But he says we are under pressure to supply oxygen to Delhi, but we shall first secure our own state's requirement and then send surplus oxygen to other states. He also added that Himachal Pradesh and Rajasthan have stopped sending oxygen from their plants across state borders. This really raises a serious question of states now not supplying oxygen to each other and what that would mean for the citizens of states where there are no plants that actually may create enough oxygen for their citizens. In the meantime, Deputy Chief Minister of Delhi, Manish Sisodia, tweeted today that he had visited hospitals in Delhi where many people from UP and Haryana are also getting treatment. There was obviously a hint there. The crisis continued during the day when two major hospitals put out notices saying their oxygen stocks would only last a few hours. But towards the end of the day, we understand there is a tweet from the Chief Minister Arvind Kejriwal acknowledging that the central government has increased Delhi's quota of oxygen, and he's also thanked the central government for doing so. And in other news, the Serum Institute of India has announced that it will sell the Covishield vaccine to state governments at 400 rupees a dose and to private hospitals at 600 rupees a dose. Adar Poonawalla, the CEO of the company, has said that he's ensuring that Covishield is affordable at these prices compared to what vaccines cost in the rest of the world, which is about 1,500 rupees a dose. He said, going ahead, 50% of our capacity will be served to the Government of India's vaccination program, and the remaining 50% will be for state governments and private hospitals. This is as per the plan announced by the central government. The Serum Institute has urged corporates and private individuals to access the vaccines through the state-facilitated machinery or through private hospital systems. He's also said that in 4 or 5 months, the vaccines will be made available retail and for free trade. There's one clarification here. There was some confusion that there would be a different price for state governments and a different price for the central government. That has been clarified by Mr. Poonawalla in an interview he gave to CNBC TV 18, where he basically said the current price for the central government of 150 rupees per dose will end when the current commitments end, and then all fresh commitments for both state and centre will be made at 400 rupees per dose. The Indian Council for Medical Research, the ICMR, has said Bharat Biotech's Covaxin neutralizes multiple variants of COVID-19 and effectively neutralizes the double mutant strain that has been found in India. The ICMR and the National Institute of Virology have demonstrated that the neutralizing potential of Covaxin against UK variant and Brazil variant as well. You must remember that the ICMR had partnered with Bharat Biotech to develop this vaccine. Staying on the same vaccine, according to the Phase 3 Interim analysis of Bharat Biotech's Covaxin, it has demonstrated apparently 78% efficacy. Now, due to a recent surge in cases, 127 symptomatic cases were recorded, resulting in a point estimate of vaccine efficiency of 78% against mild, moderate and severe COVID-19 diseases. It's also said that the efficacy against severe COVID-19 disease is 100%, with an impact on reduction in hospitalization. Basically, To put that into plain English, it means that someone who has taken the vaccine, both doses, for Bharat Biotech's COVID vaccine, there is a 100% efficacy in avoiding hospitalization if you test positive, but there is about a 70% efficacy in against mild, moderate and severe symptoms of the disease. In Goa, which has up to now avoided any sort of curfew, Goa has now imposed a night curfew from 10 p.m. to 6 a.m. starting today until the end of the month. Casinos, bars, restaurants, gyms, massage parlors, cinema halls, buses, river cruises, spas, theatres, multiplexes can function at 50% capacity. Goa Chief Minister Pramod Sawant has ruled out the possibility of a lockdown. This comes after Goa reported 1,160 cases and 26 deaths over the last 24 hours. The Chief Minister Pramod Sawant has also said they are now testing 3,000 people as opposed to 2,000 people earlier. Goa has also decided to postpone Class 10 and 12 examinations, and new dates will be announced in the future. The state of Karnataka issued fresh COVID guidelines yesterday. To give you a quick recap, if you don't already know, you might have read it this morning in your paper. The guidelines will be applicable from 9 p.m. tonight until the 4th of May. There is a night curfew from 9 p.m. to 6 a.m. every day, and a weekend curfew from Friday night to Monday morning. Cinema halls, malls, gyms, spas, pools, schools and colleges closed during this time. Essentials will be available. Restaurants and liquor shops only in takeaway, and offices have been encouraged to work from home. Government offices will function at 50% strength. The big question in intrastate movement, long distance buses, all of that will continue to function. There's no restriction on goods moving on trucks at all. Weddings, maximum of 50 people. Funerals, maximum of 20 people. Social gatherings have been banned. In Uttarakhand, the High Court has asked the state government to publish a standard operating procedure, an SOP, for the Chardham Yatra that's scheduled to start on the 14th of May. The court has observed that the pilgrimage cannot be allowed to turn into another Kumbh. The court also directed the state government to step up its COVID-19 testing, to deploy mobile vans in interior regions and increase the number of COVID hospitals, besides providing PPE kits and equipment to health workers. Moving on now away from COVID. The three-member inquiry commission that was probing the encounter killings of gangster Vikas, Dubey and 5 of his alleged associates have given a clean chit to the Uttar Pradesh police because of lack of evidence. This is according to a report by the Indian Express. Now, just to remind you, the gangster Vikas Dubey was among the people who ambushed the 8 policemen in the Bikru village in Kanpur and killed those policemen. He then fled and was picked up by the police and was being taken back to Uttar Pradesh when, in the middle of the night, the car in which he was travelling along with the police overturned and he attempted to escape and he was shot dead. Now, there were a lot of questions that were raised about this whole incident, including the ambush of the police and, of course, his killing, whether or not it was extrajudicial. We now understand that the panel that was investigating this case for the last 8 months has submitted their report, and they've said that no witnesses have come forward to challenge the police's claims, even after advertisements were placed in the newspaper and the media. Also, no one from the media came forward to give their versions either, and so a clean chit has now been given to the Uttar Pradesh police. Moving on now to news coming in from across the world. All eyes in America was on a very crucial jury verdict that was expected yesterday, and this was in the case of George Floyd, the African-American man who lost his life about a year ago, sparking the Black Lives Matter protest rallies across the country. The policeman who was on trial, Derek Chauvin, was found guilty of murder and manslaughter in that case. Remember, he used his knee to pin down George Floyd for 8 whole minutes, effectively killing him. US President Joe Biden has said that this is a giant step forward in the march towards justice in America. Former US President Barack Obama and his wife Michelle Obama said the jury did the right thing in convicting Derek Chauvin. And the Obamas in their statement said, true justice requires that we come to terms with the fact that Black Americans are treated differently every day. In the meantime, on the same day, a police officer in the US state of Ohio shot dead a 16-year-old black girl. The officer was responding to an emergency call over an attempted stabbing. The Columbus police have produced a body cam footage from the scene showing several people attacking one person before the girl is shot multiple times. An inquiry is currently underway. The officials have urged local residents to remain calm. The US media has reported that the officer involved has been placed on paid administrative leave. The Health Minister of Sri Lanka, Vania Rachi, has told Parliament that Sri Lanka has found 6 cases of blood clots among the AstraZeneca vaccine recipients, out of which 3 have lost their lives. Now, nearly 1 million people have been vaccinated in the country using Indian-made AstraZeneca vaccine, which comes from Pune's Serum Institute of India. As of now, there's been no announcement of the halt of the vaccine program, but effectively, Sri Lanka is reporting that out of 1 million people, 6 had blood clots and 3 died. Taking a look at news coming in from the world of science and technology, Russia wants to launch its own orbital space station in 2025 as it debates withdrawing from the International Space Station program. The station's first core module is already in the works. We understand the move comes after Russia lost controlling access to the International Space Station last year after SpaceX's first successful operational mission. The International Space Station was launched in 1998 in a collaboration between the US, Russia, Canada, Japan, and the European Space Agency. Taking a look at news coming in from the world of sports, there's a lot going on in football with the whole European Super League challenge that's come up. 6 Premier League clubs that were involved in the proposed European Super League have withdrawn from the Super League because of criticism. 6 clubs are Manchester City, Liverpool, Manchester United, Chelsea, Arsenal, and Tottenham Hotspur. The decision from these clubs comes 48 hours after their announcement to join the Super League, breaking away from the Champions League. But several fans, we understand, gathered outside of stadiums in England to protest against club owners making that decision. So that decision has now been withdrawn. And as a result of that U-turn on that decision, Ed Woodward, the vice chairman, the executive vice chairman of Manchester United, will step down at the end of this year. He's been one of the leading figures, really, in this breakaway European Super League project. Man U has been one of the main clubs involved in that project, and now that Man U has decided to withdraw from the project, as a result, we understand Ed Woodward has announced his decision to step down this year. One piece of positive news, which is fairly hard to come by now as times are, but we'll give you a piece of positive news. The country is currently facing, as we know, the shortage of beds and oxygen and medication. But one woman managed to find a plasma donor on Tinder. She was told, taking to Twitter, Sohini Chattopadhyay has said that she found a plasma match for her friend through Tinder. Her COVID positive friend had shared her condition and her plasma needs on her Tinder bio, and they found a dude who had recovered and had offered plasma on his Tinder bio, and that's how the two got in touch, and they managed to get the plasma they required. So hey, happy endings there. And we could use really some happy endings at this point. That brings us to the end of the news. Thank you so much for watching. Remember, share this information with other people who would find it useful. Subscribe to our YouTube channel. Tell other people that we're doing an attempt at the calmest sort of version of the news given everything that's going on. We've also done a conversation on the YouTube channel about handling this sort of distressing news from a mental health point of view with mental health professionals. Do take a look at that if you feel that that is information that you find useful as well. Thank you so much for watching. Good night.